ang aton vaccination drive. As early as 3 weeks ago, I already came up with a Concepcion COVID vaccine acceleration plan, prior to the executive order of the governor, because we really wanted to ramp up our vaccination. Records of the PHO shows yesterday that despite the fact that Concepcion is a geographic challenge, having 16 islands and 11 island barangays, we have reached already 67% of our population vaccinated. So as far as we are concerned, because as a doctor, I know how this vaccine can be the silver and magic bullet in our fight against COVID-19. Medical and scientific evidence shows that it can prevent severe illness, prevent hospitalization, and even prevent death. So for us, every day is a vaccination day. We have as many as 5 teams a day deployed to the sitio, doing house to house, and to the barangays. We have the mainstay vaccination team in our main health office, and we have 4 mobile teams. No? The support of the governor really helped. The augmentation of staff really helped because we have more encoders, nursing aid, nurses, and 1 doctor. No? And besides the staff, I personally are doing vaccination and doing vaccine advocacy. I am quite effective now in convincing those that are hesitating to have their vaccine because being a doctor, they have confidence in me, and I do the vaccination myself. And I can always use myself as an example. A 64-year-old person with comorbidities. I have asthma, I have hypertension, I have diabetes, although it's all controlled, no? But I take my regular maintenance medication. So that's why whenever there are hesitancy, I talk to them. And I have about 80 to 85% conversion. No? There are people that are really hesitating, but they just ask to give them ample time. So do not force them, uh, but just caution them not to move out of the house frequently because they are vulnerable.
Pero ang herd immunity, so sa Concepcion, saan malabot?
Well, the number set uh, by the Department of Health and the PHO is 70% of our population should be vaccinated. I even set a higher target. Because of the Delta variant, we are targeting 80% of our target population to be vaccinated. So we hope to reach this by January at the rate that we are doing with this step up vaccination effort. I hope to reach that by the end of January.
Ang 80%.
Yeah,
Ang target
but
eligible.
definitely by December, we will hit more than, now it's 67%. We only have to add 3%, which you can do in a week. Then we can have already the 70% herd immunity. And that is already uh, being felt because for we have 1 case last week, but only single case, a pregnant mother who probably got the infection from her prenatal consultation, but is asymptomatic. Unfortunately, she had a fetal death in utero, but now she is asymptomatic and is just completing her 14 days isolation. So we no longer have any active case, no, in Concepcion.
Dok, despite sa mga island barangays ninyo, anong mga good practices ninyo na pwede ma-duplicate from other towns?
Well, before the directive of the province and the national government in the 3 days national vaccination program, we already stepped up and ramped up our vaccination effort. I set already a clear target, and I required a survey of all households we mobilized the barangay health workers, the nurses, and the midwives to conduct a house-to-house survey 3 weeks ago, identifying who are the vaccinated and the unvaccinated. So our vaccination effort is very focused, targeted. We know what house, where it is located, that have an unvaccinated person. So we go to them. So we go to the sitio, and we even go to the houses, to convince these people to be vaccinated.
Do you also have incentives, Doc?
I provide them meals. Our about 70 person who are in our vaccination team, they have free lunch. I treat them every Friday to a buffet dinner.
Wow.
And,
Sana all.
yeah.